Alrighty, so I'm going to just provide some client education for dialysis and chronic kidney disease. So, the disease process of it is it's progressive and irreversible loss of kidney function. The kidneys serve to filter blood, so decreasing that function causes electrolytes, medication, and normal waste products in the blood to back up because they can't be excreted through the urine. There's 4 stages of the disease, and when it gets to that 5th stage, it's considered kidney failure, and all of those stages are objectified by the GFR. Normally, the GFR is less than 60 milliliters for 3 months in a row to be diagnosed with kidney disease. And the GFR is basically just a ratio of how fast your kidneys are producing urine by filtering the blood. Some other tests that a patient can expect are renal ultrasounds, renal and or bladder scans, and possibly a biopsy, as well as blood tests for electrolyte status, protein levels, and kidney enzymes in the blood. So, some risk factors for kidney disease that are modifiable are decreasing the risk for cardiovascular disease. This can be done through lowering dietary cholesterol, aerobic exercises, and not smoking. Achieving and maintaining optimal blood sugar is really important because having excess glucose in the blood can actually cause inflammation and swelling of the tissue, and that includes the kidneys. And maintaining normal blood pressure through sodium and fluid restriction, stress reduction, and medication compliance. Some potential causes of chronic kidney disease are diabetes. About 50% of patients with CKD have diabetes, and the other 25% are related to hypertension. And then the last 25% normally have to do with infection or not controlling other disease processes that are affecting the kidney or kidneys. Some treatment options. The priority is controlling the extracellular fluid overload or deficit. That's why we want our patients to take daily weights in the morning. Too much fluid can end up being backed up in the lungs and make it harder to breathe and then harder for your heart to beat. And if there is not enough fluid in the blood, then the symptoms of the disease are going to be worsened because the toxins are going to be concentrated. In order to externally filter the blood, because the kidneys can't, there is dialysis. There's 2 types, peritoneal and hemodialysis. Peritoneal is taking this diastolic fluid and putting it into the peritoneal space, which is just the cavity in your abdomen, and it uses passive osmolarity. It just attracts all of the toxins out of your blood and into the diastolate. So after it sits for a while, it is drained out, and all of the bad stuff in your blood's drained out with the diastolate. It is less complicated than hemodialysis. There are less dietary restrictions, and you can actually do your dialysis at home overnight or 2 to 3 times during the day. Some cons of this procedure are it needs to be done every single night or multiple times during the day. So you have to be held accountable for that. Hemodialysis is when an AV fistula or graft is put into your forearm, and your blood is taken out through the fistula, filtered through a machine, and then put back in. So some pros of this are it is a faster procedure, and there's a lower risk of infection, and you're also only doing 3 treatments a week as opposed to multiple treatments during the day or every single night. Some cons of hemodialysis are that the vascular access site can have problems. You need to have that permanently placed. It is your lifeline, and there are some pretty common complications with that. There's more fluid and dietary restrictions, and Conditions like hypotension and anemia can result after hemodialysis treatments. There are some major dietary changes that people with chronic kidney disease need to make, mostly surrounding salt, potassium, fluid, and protein. So salt should be limited to around or less than 2 grams per day, and salt substitutes also need to be avoided because they most likely have potassium in them. Potassium needs to be restricted as well because the accumulation of it can affect heart rhythms. However, this is less of a concern if you choose to do peritoneal dialysis. Fluid restrictions are normally ordered by your doctor, and protein restrictions, you just want less protein because your blood will accumulate the protein and the protein will attract fluid, and then you are going to experience fluid volume overload, which is the priority focus of treating chronic kidney disease.